this is one institution that is, in our estimation, very well run. We have actually been able to establish that with my chief officer and the team of doctors accompanying us this moment. And we are here to really put the record straight as far as a few operational areas are concerned, which have definitely become matters of concern to the general public, particularly Embu community. One, we are here to establish, and that already confirmed officially, that we have enough isolation beds in our hospital, that is Embu level 5. We also have confirmed that we have enough ventilators in our ICU, facilities, actually a total of 21. Isolation beds, going by what we have actually been able to confirm, and also doing collection of what is coming from other health centers within the county, we are actually reporting a total of 308 beds, that one confirmed, but largely we have actually been able to confirm that is actually the situation on the ground yet Embu level 5. The other bit is on oxygen availability in our Embu level 5. That has also been a matter of concern, but as I've said, we are here to set the record straight. Our hospital, that is Embu level 5, is well supplied with oxygen. We have actually too much of it. We have both owned and new oxygen plants that are fully operational. We have not had a single patient actually not getting attended to as far as oxygen requirement is concerned, because we have all the capacity, we are having it well produced, and the two plants that we have actually, and we have confirmed this, supplied all the wards, definitely, of course, as expected. So as far as oxygen availability is concerned, I must say this with authority, that we have enough of it. We have taken the media people around, they have confirmed for themselves, and therefore we wanted to actually discount the rumor that has actually been doing rounds on social media and even in some of the mainstream media, that Embu County level 5 is not well oxygen supplied. That is not actually the position on the ground. We have actually a new oxygen plant, newly installed. It started the operations last month. And as I've said, it's giving us enough oxygen for actually all the facilities in our county. So as far as oxygen availability is concerned, that is not really a matter of concern, and we wanted to also assure particularly the county residents that that is an area that is well taken care of. Then the other bit is on patient management. That is, of course, as a hospital, the way we manage our patients. And I'm happy we have a team here of medics. We, of course, observe all the advised confidentiality when it comes to patient management. Of course, when a patient comes here, there is, of course, that medical process that they are taken through, and this is not influenced in any way by the relatives, by any office. We actually largely rely on the medical advice that is given to us by our medics on the ground. And that has been done really very well. And I want to take also this moment to thank our medics who are actually particularly in Embu level 5 for really making sure that our patients are well attended to. What needs to be observed is well done professionally. And that I want to believe and I advise, of course, continues going into the future. We have under cases where patients are visited in Embu level 5 and other, of course, hospitals, not only here, even in other parts of the country. And when patients, the people visiting their patients get there, they realize and they make their own estimation that their patient should be moved maybe to ICU, should be moved to high dependence unit. It doesn't work that way. And we have also under similar, of course, concerns expressed by the members of the public. And we want to advise that when we have an hospitalized patient, the advice on the general patient management is, as I've said, the work of the professional medical personnel that we have. They are the ones who advise when to move a patient to ICU. They are the ones who advise when to move and given patient to our independence unit or any other area of course interest. So I wanted to put that record very straight, so that we don't have issues where when the patients are visited and somebody demands that my patient should be in ICU, my patient should be in independence unit. It doesn't work that way. Here we are always well guided by our medical personnel, and I wanted to also advise the members of the public that is basically the way basically it should go. As well as again our facility here is concerned, there has been a concern on the ambulance's position. I would also want to put the record very straight. We have actually confirmed with my team. We have operational ambulances. Actually, we have quite a number right now out there serving our community. The media people have actually been able to confirm for themselves that we have some here fully operational on the standby just in case of anything. So again, that should not be a matter of concern. And we have quite a number still on the way. That is in terms of we are definitely looking into the ones that are the mechanical issues. They are almost getting back. But that notwithstanding, we have enough, for now, ambulances that are able to attend to any reported emergencies, and therefore it should not again be a matter of concern with particularly our community. Definitely there has been a lot of misleading information out there concerning particularly our Embu level 5, and it's quite unfortunate, and we want to put the record very straight to our community, because this unfortunately has also created a lot of misplaced fears. One, Embu level 5 hospital is one institution that is professionally run. We have our CEO here, well assisted by the team behind me. We would want to particularly advise those who are pending lies about this great facility, that we don't have oxygen, we don't have ambulances, we don't have ICU or ICU units that are operational. We would advise that before they post any misleading or disparaging information on social media, we really as a county would request, because they are our people, they engage with us, we give them all the information so that we don't create unnecessary fears to the community that we really are serving. So our request is, anytime they want any information available to them, we are ready with my chief here and my other officers, and we are not going to hold back any information that can actually shape the image of this great county. At the moment, we have, as I've seen, a number of isolation beds. We have in the county 358. Total occupied, and this is good news, only 2. And it's this, or I mean, the ones occupied, we have only one COVID case confirmed. The other one is actually suspected. We're talking of just 2 out of the 358 available isolation beds in the county. Yeah, definitely Embu, and I think this is because of its central location. We get so many, of course, patients from the neighboring counties. We are talking about Tharaka Nithi, Kirinyaga, Machakos, these other lower side, Makueni, and other counties. Yeah, so basically we are getting a lot of patients from other counties, and we have actually been able to attend to all of them. We don't turn away any patient, because anybody coming here for medical help, we consider, of course, them our brothers, our sisters. The 3 fully operational ICU units and also independence units. They have a total of 28 beds. They have a total of 28 beds.